What are some of the biggest market pressures healthcare systems are facing right now?
We could probably spend the whole hour just on that. So
Yes.
first off, thanks for hosting today. Look forward to this conversation, and thanks everybody for taking the time to listen in here. Yeah, I feel like I'm going to start with like maybe a bit of a dark cloud, but there's light and things we can do about this. But it's a definitely, you think about healthcare generally is already a very dynamic environment, one of the most dynamic industries in the U.S. So even in a normal environment, we're always dealing with a litany of changes and challenges and competing priorities. So even the best are always dealing with a lot of change. You think about the last maybe 24 months, things are starting to somewhat normalize on the heels of COVID, getting back to growing patient volumes and improving financial performance. Is just as we're kind of focusing on that, you see the last few months, I think, has introduced a number of potential legislative, regulatory, and economic headwinds. It's causing a variety of different actions by providers. Sometimes a wait and see, but really not certain about what to do for the long term. It's interesting, there was a survey this week that Deloitte put out of both providers and payers and what they're most worried about. And 84% of executives were worried about business conditions, given this cloudy policy outlook, economic concerns, and the disruptions from tariffs and the supply chain. And so from our seat, being a provider into service provider into healthcare, we felt some of that, particularly in the second quarter, just a slowdown in buying decisions. Everybody's trying to navigate these changes. I won't go through all of them in detail, but because we all know those. But the headlines we're seeing around, the tariff trade war that really started in April and the potential impacts that would have on cost inputs for supplies. We've already seen significant wage inflation over the last several years and the potential for more of that coming from this, and then the fear of recession as well. And then right on the heels of that, you had, the big, beautiful bill coming through the House, and now it's working through the Senate, and the potential for cuts, whether it's to Medicaid, provider taxes, et cetera, that could be to the tune of over $1 trillion over the next 10 years, along with ACA changes that could, drop 10 million plus from their roles as well. So, we know that these will all get worked out, and this industry is really good at navigating and adapting to change. But until there's certainty in what those are going to be, it makes it just harder to decide how you're going to move forward as well. So those are just some of the things we're seeing. We know that it's not the same for everyone too, whether you're acute or post-acute in home, rural, urban. There's all these factors have different influences. Rural hospitals, particularly as you think about these proposed Medicaid cuts, are going to be hit even harder. Typically, they're already in a more challenged financial situation. So that's definitely going to be something to watch as well. So now that I started with all this kind of concern, I think there's also, there's ways to adapt to this and take action as well. And we know healthcare leaders are really good at adapting. And so I think this is also a time to really make sure you take action. These kind of challenges can also create opportunities to rethink the way you structure your business, the way you organize your teams, so that you end up being more efficient, and can focus on driving profitability. And there's lots of tools and partners out there that can help you do that as well.
Jim, what's your perspective here? Are you seeing the sunshine? Are you seeing the rain?
I see a path forward to the sunshine. Yes. So, my angle is more on the workforce shortages, and really want to focus a little bit, start off with attrition and scalability. So, attrition remains high because really the underlying drivers really haven't changed. So, you're dealing with burnout, generational exits, career reassessments, and we're starting to see more internal mobility limitations, right, due to the recent funding and budget constraints. So that's reducing opportunities for career advancement, for clinicians at their present location or healthcare system. So really, until we start to really address those drivers more holistically, the talent drain will continue. We also know that on average, the first year turnover rate has been sitting between 25 and 30%. So, that is something that needs a specific approach, and really being able to overcome that and mitigate that best we can. Because really, when you look at that, right, the turnover percentages really contribute significantly, right, to the cost and the operational strain of healthcare organizations. And so that leads me really to the ability to be able to scale for staffing, right, up or down, right, without overcommitting for FTE budgets. At this point in time, right, it's crucial during the funding uncertainty. We're seeing headcount freezes. We're seeing shifting in some of the workforce demands. And so as labor typically is either the largest expense or the second largest expense for any healthcare organization, typically sitting about 50 to 60%, right, of their operating costs. So therefore, it's such a significant portion that any inefficiencies in how you bring in labor and, with vacancy rates or overtime premium pay, underutilization of your FTEs really can lead to substantial cost overruns, right? And that's where, organizations that have more of a workforce strategy, more of a focus on position control, and being able to pull those critical levers, right, to help manage their overall financial performance. So, that's where I think labor is the big piece.
JB, I want to turn to you here as well, and your perspective on this. What are you seeing? What are some of those pressures that are relevant to you?
Sure. And a lot of my perspective will be from that kind of recruiting, talent acquisition point of view, because that's what I do. I'm a recruiter by trade. But Brian brought this up, wage inflation. I think it's you were talking about the cost of labor, Jim. Wage inflation, if we look back 2010 through 2019, kind of pre-pandemic, it averaged like 2% a year for hospital nurses. Over the last 3 years, it's jumped up to 7%. So in the first quarter of 2025, the base pay for a hospital-based nurse averaged about $52 an hour. If you add in the supplemental pay, the differential, the overtime, it was close to $80 an hour, which is really approaching that premium labor cost. Another thing in the data I think that's important for a lot of people that are probably on this call, the number of just unique people, team members that we've hired has actually increased by 5% over that pre-pandemic trend. So we're trying to counteract the high cost of nurses with adding in support staff, maybe building out float pools. But at the same time, the number of administrative and supervisory staff has dropped by 10%. So 5% more people to manage and 10% more leaders and managers within the organization. So that it just creates a unique environment here that stretches us even thinner.